The future of the pandemic is looking a bit clearer. For many, this means it's time to start the family they may have been delaying. In fact, some experts predict a baby boom on the way. But from morning sickness to adopting a nutritious diet, pregnancy can be overwhelming, especially for new moms. So in the program today, we'll walk you through what to expect when you're expecting. I'm Dr. Freddy Gomez and welcome to MedTalk Health Talk on CNN Philippines. The key to a strong baby is a healthy pregnancy. Our guests are here today to tell us more about this. With us is Dr. Maria Linda Quevedo. She's an OB-gynecologist from the Asian Hospital and Medical Center and the head of maternal fetal medicine. We're also joined by Ms. Alodia Mercado, who is a clinical psychologist from AMAC Psychological Services. Thank you both for joining us on this program today. Now, whether you're having your first, second, or even third child, deciding to have a baby is a very big step for any family. Now, Ms. D, what are some factors to consider kaya before deciding that a baby is going to be added to that family? What are some of the emotions that first-time parents would normally feel at this moment?
Hindi nakakagulat that women's preconception desire of conceiving a child is very linked to their values, to their goals, their employment, financial and emotional circumstances. No? And of course, the kind of preference of their partner has. All of this have to come on a first issue of pregnancy. It is very important na handa ang isang babae bago siya magbuntis.
Is there a point where someone can really say, you know what, ready na ako to have a baby?
Sociologically speaking, there is no exact time or date no kung kailan tayo talagang sobrang ready when it comes to pregnancy. Napakahalaga na mai-posisyon natin yung isang taong magbubuntis doon sa kapasidad niya to develop a fetus inside her womb. Like physically, no, ready ba yung katawan niya? Meron ba siyang condition emotionally that she has to actually deal with before getting pregnant?
So let's talk about that naman, the physical readiness ng isang babae to have a baby, because having a baby changes a lot of things, not just for the woman involved, but for the couple. So having a healthy pregnancy begins even before you get pregnant. For one, you need to understand your fertility as well as your ovulation cycles. Now, Dr. Quevedo, let's discuss that. Why should expecting moms track their fertility?
Yes, assuming they have a menstrual cycle, we all know that peak fertility for every woman would be about 20 to 24 weeks age of gestation. So by the time the woman reaches 40, sometimes fertility drops as much as 95%. And like Ms. D said, nowadays, women have the option now to delay reproduction. Normally, a couple with unprotected coitus for 1 year should get pregnant. And particularly for women beyond 35 weeks age of gestation, if they have unprotected coitus for more than 6 months and nothing happens, again, this is the time to refer to your favorite reproductive endocrinologist.
Dr. Quevedo, you bring up a good point. You mentioned how if in 6 months there's unprotected coitus and they're trying to have a baby, hindi nangyayari. One of those factors was stress. Stress at work, stress at home. How big of a factor can stress influence the fertility of a woman?
I cannot give you a ballpark figure on this, but definitely it factors in greatly in the ovulatory cycle of a woman.
Now, Dr. D, let's talk about stress for that matter. It's really popular, especially here in the culture here in the Philippines, na kapag may bagong kasal, they expect na may baby soon after. Maybe a year, maybe 2 years after kasal, may baby na. Does this put some undue stress on the mother or on the couple, leading to even more difficulty in trying to conceive?
Yes, Doc Freddy, no, napaka-importante ng role of stress and stressors sa kapasidad ng isang babae to conceive a baby, no. And these pressures going on in the environment of a couple or from an individual just like a woman is actually making an increase in the release of cortisol level or these hormones. This actually is a very great factor or an important factor in one's capacity to produce a baby, Doc Freddy.
I'd like to ask Dr. Quevedo, so once the woman is now pregnant or she has conceived the baby, how soon should she get her body ready in terms of nutrition?
Well, actually, preparation for pregnancy should be starting in the preconception period, no? It is best that the woman is in prime condition before she attempts to get pregnant. This would lower the risk for complications for both the mother and the developing fetus. And she would be psychologically prepared for pregnancy. So, prior to getting pregnant, as much as possible, she should reach ideal body weight and she should already be properly immunized, no? Of course, the woman also, if she has medical conditions, this should be addressed and stabilized prior to being pregnant. And she should already start with her supplements such as her folic acid, which is imperative for the development of normal central nervous system for the developing fetus.
That's true, Dr. Quevedo. But despite following all of that and trying their best to be physically prepared, sometimes complications can't be avoided or prevented during pregnancy. When we return, what to do if they arise. We're your partner in healthcare. This is MedTalk Health Talk. Today, we're talking about steps for a healthy pregnancy and a healthy baby-to-be. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk. A common condition that affects a lot of pregnant women is morning sickness. Now, this usually occurs within the first few months of pregnancy or may progress further. And although it's called morning sickness, it can happen at any time of the day. Dr. Quevedo, why does this happen? What should a first-time mom expect?
Well, you call this hyperemesis gravidarum, no? It may be so bad that the patient may need hospitalization for rehydration. We would advise these women to avoid taking 3 full meals but having small, frequent feedings.
A follow-up question to that. With many bodily changes, a woman who is preparing for a baby sometimes often reports that their sense of smell heightens. Why does this occur naman?
It is because of the hormones of pregnancy. So we try to tell them to avoid very tasty fried foods. It's better that they take bland foods, and sipping ice chips would even help.
And with that in mind, Ms. D, Dr. Quevedo mentioned that a lot of these changes that a woman carrying a baby may feel for the first time can be overwhelming because of the hormones. Gaano ka-importante that she feels na hindi lang siya yung na-challenge sa ganitong process?
The misery that every woman has to go through in morning sickness may cause a lot of mental and psychological conditions. No? Ilan sa mga sintomas ito yung isolation. And because of this, so isolation could be the cause to develop certain serious psychological problems related to depression. Because of this, sometimes they are confused about how their body is actually functioning during the term of pregnancy. And it is quite important that the partner is actually able to suffice the needs emotionally, no?
Now, Dr. Quevedo, let's talk about preeclampsia because it's one of the most common high-risk conditions during pregnancy. What is it? How does it happen?
Well, preeclampsia is new onset hypertension, no? What is important is we identify those women at risk for developing preeclampsia. These are women who are more than 40 years of age. This is the first-time moms, or they have multiple gestations, or they have pre-existing diabetes mellitus, and so forth and so on.
Now, I'd like to talk about, Dr. Quevedo, some of the risk factors that can influence the health of the baby, and that is cigarette smoking and alcohol drinking, for that matter. Now, how big of an impact can this have on the baby?
During the entire pregnancy and preconception, we already advise the women to stop smoking and to stop drinking alcohol. We know that taking of alcohol can give your fetal alcohol syndrome, and this will result to small babies. There may be facial deformities in the developing fetus. For smokers, likewise, you will have small babies. You may have sudden infant death syndrome. There may be fetal digital anomalies. So to avoid all this, you have to advise the women to stop smoking, and even the fathers.
Now, Dr. Quevedo, let's go back to preeclampsia, because this is the most common complication here in the Philippines when it comes to moms, and especially first-time moms. Is there a screening process in order to catch this early?
Well, the easiest way is to do the mean arterial pressure, no? We check if it's higher than 90, probably this woman would have preeclampsia. And there are also higher screening serum tests such as placental growth factor.
Now, Dr. Quevedo, is preeclampsia a risk greater for the mom or for the fetus?
It's about 50-50, no? If the blood pressure is not controlled, she can go into eclampsia, and she could even have a cerebrovascular accident, no?
Ms. D, Dr. Quevedo brings up a good point that we're talking about all of these risk factors and they are ever present. So I'd like to talk about the extremes on this end. Those who've undergone either a miscarriage or a complication through preeclampsia where the fetus was lost. So they have so many different feelings. It not only affects the mother, but those loved ones around her. They don't know, they aren't sure on how to be supportive. So just an insight on what is okay to do. Is it okay to feel all of this stages of grief maybe?
Yeah. Yes, Doc Freddy, when it comes to losing something or someone, no, we have to undergo that stage of grief, like what you said a while ago. We cannot expect a woman to automatically accept what actually happened to her. There is a process for it. So the first thing that you have to do, support for this woman, is just to listen. Let this woman express. And it is very important to process these negative thoughts. It starts with acceptance. And the acceptance actually run for around 6 months, Doc Freddy. But if the symptoms are still there, we have to accept the fact that this woman has to be referred to a professional.
Now, when we return, additional tips in order to maintain a healthy pregnancy. Your health is our mission here on MedTalk Health Talk. We'll be right back. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, where your care always comes first. Starting a family is one of life's greatest joys, and a healthy pregnancy means a healthy baby. But with so much information out there, it can be hard to determine the best healthcare practices. Sometimes these moms may get progressively uncomfortable, and that is only but natural. Now let's continue the discussion on how the pregnancy can be both beneficial for the mom as well as for the baby. Dr. Quevedo, we've talked about a lot of good benefits on how the new mom should prepare herself for being pregnant. Now let's talk about some of the things wherein a lot of viewers may be unsure of. One of that is exercise. Is it okay for someone who is pregnant to exercise? And if so, ano yung at one point should they lessen or even stop?
Exercise is allowable during pregnancy, particularly low-impact exercises. But there are certain conditions wherein exercise is absolutely contraindicated, such as when a woman has cardiac disease, or if she has uncontrolled preeclampsia, or if she has persistent second and third trimester bleeding.
Dr. Quevedo, how about sexual intercourse for those couples? Are there any do's and don'ts in terms of stages in the pregnancy?
Sexual intercourse is allowable so long as the woman is not in danger of having preterm delivery, nor is she bleeding.
Now, Ms. D, earlier we talked about a lot of the emotional journey that a new mother can undergo. What about the supportive partner in this situation? What kind of acknowledgement should the partner have in this, either be the husband or the life partner?
If we're talking about women who are really challenged physically and mentally during pregnancy, I would recommend light stress in their relationship. So if there are serious concerns in the family or in the partnership or in the relationship, they must be able to understand that there is actually a benefit for taking things lightly. But of course, we don't want to be toxic positive here. I would like to account the importance of communication here. It is not about what you say, but it's actually how you say those issues and concerns to the pregnant woman.
Now, Dr. Quevedo, while undergoing pregnancy, especially during the advanced weeks, the mother may feel a lot of problems when it comes to joints and pains, especially low back pain for that matter. How can these things be addressed?
Well, low back pains, of course, you have the added weight of the gravid uterus during pregnancy. There can be some belly support which are available in the market, and she should be encouraged to rest during daytime.
Dr. Quevedo, I ask this because of this follow-up question. When it comes to medications, many other doctors in different specialties are very careful in giving medications, especially to pregnant women. It always has to be cleared with the obstetrician first. So my question for you is, when it comes to pain relievers, should they hold off first and seek advice before they take any pain reliever?
Well, low back pains, you have to diagnose first what is the cause. No? She might be having premature contractions, in which case we give some uterine relaxants, and it might be caused by some medical conditions such as urinary tract infection. So we have to clear that up.
One more question with regards to that. You mentioned urinary tract infections. Do urinary tract infections, Dr. Quevedo, increase when a woman is pregnant?
We have to address if there is a urinary tract infection present, because this may become an ascending infection intrautero and may adversely affect the developing fetus. So we have to address all infections. Asymptomatic bacteriuria, which is urinary tract infection, which the mom doesn't feel anything at all, has to be checked periodically. And it's pretty common in pregnancy.
Unfortunately, that's all the time we have. But before we go, Dr. Quevedo, do you have any additional tips?
We have a lot of moms who are still undernourished. So it is imperative that you have your daily recommended allowances for your micronutrients and your macronutrients. And it would be best that if you seek a consultation with your obstetrician gynecologist to ensure a healthy baby and pregnancy.
And of course, Ms. D, before we go, any advice from you?
To all the pregnant women, seek medical support for access of correct information, extend awareness, be aware of the changes in your body, communicate how you feel with others, understand that experiencing negative emotions is part of the process, reduce unhealthy lifestyle, and of course, enrich your daily life by spicing up your routine, by creating your passion, learning new things, and of course, connecting with people.
We hope these tips help new parents and first-time pregnant moms face the changes that will be coming their way. Thank you so much, Dr. Maria Linda Quevedo and Ms. Alodia Mercado, for being with us today. Your tips and insights will definitely help a lot of our viewers in their journey towards a family. I'm Dr. Freddy Gomez, and thank you for watching Med Talk Health Talk. We'll see you again next time.